Hello, my name is Erica. I'm going to be the nurse that's working with you today. I was told that you just found out that you have diabetes. So we're going to do some education on diabetes. So there are different types of diabetes. All types are complex and serious. There are three main types of diabetes. There's type 1, which is usually seen in children. Type 2, which the onset is adulthood, and gestational diabetes, where you have it during your pregnancy. And specifically, we're going to talk about the pathophysiology of diabetes. Pathophysiology means the study of abnormal changes in body functions that causes disease. So, pathophysiology of type 2 diabetes. The pancreas is not secreting enough of the hormone insulin. Within the pancreas, it has beta cells. The beta cells sense increased glucose levels in the blood. Patients with type 2 diabetes, their beta cells have lost its function. Insulin is responsible for controlling glucose levels in the blood. Insulin is produced in response to high blood glucose. After we eat, glucose enters our blood. This causes the pancreas to produce insulin. The insulin signals muscle cells, fat cells, and liver cells in the body to absorb glucose from the bloodstream to be used as energy. This will decrease the glucose levels in the blood. People with diabetes type 2 have dysfunctions going on. So, their beta cells are not functioning properly. Therefore, not enough insulin is being produced, and glucose will build up in the blood, causing diabetes. If the cells are not responding properly to the insulin in the blood, then muscle, fat, and liver cells in the blood cannot absorb glucose from the bloodstream. This causes glucose to build up in the blood vessel, causing hyperglycemia, and the person will develop diabetes mellitus. So that's a key word for you to understand, hyperglycemia, because hyperglycemia means that you have a high level of glucose in your blood. And also, the opposite of that is hypoglycemia. That's when you don't have enough glucose in the blood. But back to hyperglycemia, this is known as insulin resistance. Risk factors. So the risk factors for diabetes is genetics, hypertension, age greater than 45, dyslipidemia, Native American, Alaskan Native, Hispanic, non-Hispanic, Black, or Asian American race or ethnicity. History of gestational diabetes or delivering a baby with a birth rate equal or greater than 9 pounds. History or currently impaired fasting glucose or impaired glucose tolerance. Overweight or obesity. Polycystic ovarian syndrome, which results in insulin resistance. Fat distribution, which is increased risk with waist circumference greater than 40 inches in men and 35 inches in women, and a sedentary lifestyle, which means you do little or no exercise. Pre-diabetic state, or a diet that includes high consumption of red meat, high-fat dairy products, sweetening beverages and desserts, and processed foods. Causes. Now, there are different causes to a person having diabetes. One cause could be environmental pollutants, which is long-term exposure to traffic-related pollution. Genetics is another one that can cause you to have diabetes. An example of that is involvement of multiple genes in pancreatic beta cell failure and insulin resistance, and a genotype susceptibility, which is increased risk of diabetes with excessive weight that varies among ethnic populations, and medical conditions that antagonize the actions of insulin. An example of that is Cushing's syndrome and acromegaly. Medications can also cause diabetes. Some medications examples would be glucocorticoids and antipsychotics. Now, there are many complications that your body can have from diabetes. So some examples include atherosclerosis, cardiovascular and peripheral vascular disease, blindness, cataracts, damage of the macrovascular and microvascular arterial cell walls, gangrene in the extremities, glaucoma, hyperosmolar coma, neuropathy and chronic kidney disease, osteoporosis, peripheral neuropathy, possible Alzheimer's disease and vascular dementia, hearing impairment, and stroke. Now, do you have any questions? Okay, thank you.